This is 3-year-old female child who is presented with seizures, fever, fever from 5 days, seizures since 1 day, and if you see her routine sequences, nothing really jumps out except for the periventricular hyperintensities on T2 and flare images, which I was suspecting why so many white matter changes, maybe old ischemic things going on. That did not jump out at me, but when you look at the post contrast images, you see there is enhancement in the bilateral head of chordate nuclei as well as the putamens and some part of again putamen, and yeah, so a tiny bit of contrast you can see in creeping out in thalamus as well. Rest of the parenchyma, especially the periventricular lesions, uh, other than the chordate and putamen areas, do not take contrast, especially these things. So maybe they are like different etiologies, like, and so in this case, the differentials for mm, bilateral symmetrical enhancements in basal ganglia are not much. And when I actually went on to find it, I found this article here, and it showed this that. Alright, let me zoom in for you. Okay, so it says that the contrast enhancement is present either in infarction, which makes sense in subacute infarction. There will be breakdown of blood-brain barrier, but also in herpes encephalitis, which it will be positive. It will be T2 hyper, it says, and T1 it will be normal. Diffusion restriction is not being commented uh, on that same thing. So yeah, okay. So on T2, I wouldn't call that really hyper. Not really. Yeah, I wouldn't have called it hyper at all actually. Yeah, interesting. Cases like this makes me wonder that whether contrast should be given to children who have normal, so-called normal MRIs, um, or just not having a collaborative findings on MR, because these findings do not explain, these white matter changes do not explain the acute finding of the seizures, which would point towards the more acute things. There is no restriction and as such. Uh, if I really have to point out and say, uh, can this be a restriction on diffusion weighted imaging? Well, yes and no. Like, I can see a bit of hyperintensity on the bilateral chordate things, but it is so damn symmetrical that I'm not really sure about what it should be called. However, this area of vitamin does look like hyper most of the time. So whether this is hyper compared to the usual hyper appearance of chordate nuclei is up to for debate. So yeah, that's it. I just wanted to show you this case that um, sometimes you can get stumped by having um, seemingly seemingly uh, findings which are seemingly uh, so obvious, but then you are finding it so difficult to correlate with. Um, yeah, yeah, especially when you have two different pathologies going on. I don't think the white matter changes and dilatation, a bit of dilatation of lateral ventricles is explained by encephalitis. Obviously, in long-term encephalitis can cause cortical atrophy and other changes, but still. Alright then. Sure. Thank you for your attention. This case was shared by Dr. Sarita Kumari. Thank you for sharing this case. And if you have any questions or similar cases like that, please feel free to share it. Thank you.